Good morning. Welcome back to the Broadcast Retirement Network. I'm Jeff Snyder. This is BRN AM for Wednesday, March 22nd, 2023. And our top story today, tooth decay can cost close to $28,000 if left untreated. Joining me now to discuss this and a lot more, Jamie Dudley is a dental hygienist with Towson Dental Care. Well, Jamie, it's great to see you again. Thanks so much for joining us on the program this morning.
Thanks, Jeff. It's great to be here. Good to see you too.
Yeah, it's great to talk dental care, and as you've told us before, dental care really relates to your overall health, and it's really important. I want to hit you with one figure that I found online. I want to get your reaction to this. Tooth decay can cost up to $28,000 when left untreated. That's a significant amount of money. You think about the cavities, all the things that have to be done if you don't take care of your teeth. It's pretty substantial.
Yes, that absolutely is. And sadly, that can be the case sometimes. So having a really good start to preventative, ideally preventing things like cavities and gum disease starts with really good home care, because as you're stating facts, it can be financially very cumbersome for things left untreated for whatever reason. People do not go to the dentist usually out of fear and sometimes financial reasons, but usually more from an anxiety point of view.
Yeah, I want to ask you about the anxiety in a second, but most people, whether through an employer or individually, have access to dental insurance. And even if you have to buy it individually, I know I buy it for both my wife and I, it's not too expensive, and it gets you at least 2 cleanings a year.
Sure. It's definitely a good thing to look into your health insurance, including your dental insurance options through work. Also, usually they do have some kind of option that you can purchase for a little bit less. Having yourself going in for a couple of visits each year just for cleanings is really important, not only for the cleaning aspect, but also the information that you're getting back and that you may not know otherwise. Cavities, pain, anything associated with things like cavities, and even gum disease can be completely silent. So that is one of the really important keys to addressing these things much sooner before they become a very expensive financial burden potentially.
Yeah, as you're talking, I'm noticing a little bit of a dull pain in my lower right jaw that I'm going to have to get checked out this week when I go to the dentist. Excuse me, Jamie. Let's talk a little bit about anxiety, because mental health has been a major issue in our society, not just when it comes to the dentist, but when it comes to dealing with a lot of issues. That post-pandemic mental health just hasn't really balanced out for a lot of people. Why do people feel anxious when coming to the dentist? Could it be the fact that, just the unknown? Why do you generally see people anxious?
Very good question, Jeff. A lot of the patients that I have that have dental anxiety state that they have usually they've had some kind of pain or negative experience associated with a previous dental experience, and they carry that through their life, whether it is in childhood or adulthood. I would say that is the primary cause that we see at our office. Fortunately, our office does focus on sedation dentistry, because we do know of the need for this population of people to get themselves into the dentist. Sometimes the only way they will find themselves able to mentally take this on is knowing that they have options to calm their minds and calm the pain, which can help to start the new process of hopefully lessening the anxiety to a degree where they will start to come in a little more frequently.
Well, Jamie, I know I've known you for a long time, and I know and your fellow dentists and hygienists, you're not torturers. You've been trained in techniques to help mitigate a lot of the anxiety and a lot of the pain. I think about the needles when I was a kid, and I remember in 5th grade having to get my first cavity filled. I was petrified, but the techniques today are designed to minimize pain, anxiety, and also improve that mental health.
Yes, this is very true. With regards to how we approach dentistry from all aspects, whether it's cleaning, restoratives like filling cavities, it is really important to address the mental aspect inside everybody's head, because everybody does come with a different set of experiences. I always keep in mind that I'm addressing every patient as I hope I would be addressing the situation. And it's a very vulnerable position that patients are in when they're coming in here for anything that they may be. So we do have techniques to help keep minds at ease, just simple things as far as location and how and where we place like the anesthetic prior to making patients numb, how we speak to patients, questions that we ask or don't ask. There are devices also that can be used to help the patient's comfort level mentally too, along with things like nitrous sedation, IV sedation. So there are lots of things at different levels that we can do to address the overall comfort of our patients. Again, we want them to be able to come in, and chasing them off with a cool demeanor and heavy-handed dentistry is going to keep patients away for sure.
Yeah, and you want them to come in, and this is, after all, if you remember the movie Castaway with Tom Hanks, there was a point where he had to pull out his tooth with rope, and that is not what we're describing here. Jamie, I need to take a very quick break. When we come back, we'll talk about more preventative care for you and the rest of your family. You're going to want to stay tuned right here on BRN AM. Imagine a new television network that will make you richer, healthier, and in control of your financial future. This network is for the policewoman in Nashville, Tennessee, the baker in Dubuque, Iowa, the teacher in Lexington, Kentucky. We want to make the idea of savings and retirement culturally relevant. But what do you see as a defining issue of the midterms? Especially for the smaller businesses. I mean, they are the lifeblood of the American economy. Featuring exclusive interviews, current affairs, and docuseries. 33 years old, you retired early.
The philosophy is money only matters if it helps you live a life that you love.
But you got to start thinking about retirement as soon as you get in.
The Broadcast Retirement Network will drive very high engagement with premium partnerships. So this isn't retirement and savings for your parents or grandparents. This is for all Americans. And we're going to change the way you think about money. Welcome to the next frontier of retirement and savings. This is BRN, the Broadcast Retirement Network.
Are you stuck with a low credit score? A credit report and score that's causing you to be denied credit or pay higher interest rates than others for the same things? Then do what Terrence did and call Credit Repaired for your free credit evaluation to help restore your credit.
I started thinking about buying a new house, and my score wasn't where I needed it to be. I called and spoke with one of the representatives, and we just had a good conversation, and I liked what he was saying.
Just one call for his free credit evaluation was all it took to start back on the track to repairing his credit.
I'm seeing the deletions and I'm getting the report, so I know something's being done. It does make a difference to me.
All it takes is one call to get started.
Credit Repair has given me a second chance to have a better credit score.
Don't let a low credit score hold you back another day. Do what Terrence did and make the call for your free credit evaluation.
Call 800-819-4152. That's 800-819-4152. Again, 800-819-4152.
Welcome back. We're joined this morning by Jamie Dudley. She's a dental hygienist with Towson Dental Care. Jamie, thanks so much for sticking around with us this morning for segment number 2.
Thanks, Jeff. Great to be here.
Yeah, real quick. When I was a kid, there was something called the treasure chest when I went to the dentist, and I could pick a toy. Is that still around?
Yes. Treasure chests are still around. In fact, I recently took my 5-year-old to his pediatric dentist, and the only way that I could really get him to commit without problems is knowing that he gets to pick his own toy out of the vending machine that they have. They have a vending machine of various things, from little dinosaurs to rings to erasers. But the power of a toy for children is it is a very powerful thing. Even for adults, we have our version of treasure chests. We call it our dental swag bag treasures. With various things, of course, toothbrushes to maybe tools that they didn't even realize existed, like little Proxa brushes and information packets. But it is very motivating to get anything additional free, especially if it's a toy for a kid or an adult.
Yeah, I could still see it up in my head. I see the vision of the treasure chest up in the closet at the dentist, and I was just salivating, waiting for my procedure to be over to pick from that. Jamie, you mentioned your 5-year-old son. Let's talk a little bit about pediatric dentistry and how important it is to get your children off to the right start when it comes to brushing your teeth. When does this start? I mean, when do you start teaching your child how to brush his or her teeth, how to do flossing? Does it start at age 2? Does it start when they start getting new teeth? I want to ask you.
Sure. You want to start dental hygiene practices the day they are here on this earth, starting as soon as when they are newborns. You want to actually take a warm cloth and just wipe their gums. You want from day one to have that child be familiar and comfortable with the idea of cleaning and being inside of the mouth to keep it healthy. As they get older and start to get some of their baby teeth, I would say that's generally when we would recommend them starting dental appointments, when their teeth start cutting through. There's no exact right age, but the sooner the better, even if they do go, let's say, with a parent just to observe and see what goes on, making it obviously very positive experience and positive words, but having healthy primary or baby teeth is incredibly important for the foundation of their adult teeth health. Just because we lose our baby teeth doesn't mean we don't need to take care of them. They are doing so many important things that we need them for, including holding the spaces for our adult teeth, which I'd say is pretty darn important. Our baby teeth are very important, just as important as our adult teeth. So forming really good home care habits the day they are here is the best way to go.
Yeah, and I like that you say, taking the child with you to the dentist so that they can see what happens and about forming great habits. Jamie, let's talk in the remaining time about what we can do, and maybe you've seen from some of your clients, to out your clients in terms of what they're, who they are, but what are some things that we can do better in terms of preventative care? Do we still brush 2 times, 3 times? What are some of the key takeaways in terms of prevention?
Yes. So a few really important things to, let's say, brushing. You want to make sure you have a soft or extra soft bristles. That is really, really the most important detail to your toothbrush, besides it being a manual or an electric. Make sure you have soft bristles or extra soft bristles on your toothbrush. You do want to brush for 2 minutes. You want to brush at least twice a day. Those are the main components to, to take in when you are brushing your teeth. Flossing, you want to at least do that once a day. Some people find that they need to do it more than once a day. You don't really want to say some people can get away with a little bit more or a little bit less, depending on how their teeth are aligned or what's going on in there. But ideally, you should be flossing or using some kind of cleaner, like a water flosser. There's in between the teeth cleaning tools like Proxa brushes, Stimudents to also help get in between the teeth. So brushing with a soft bristle toothbrush for 2 minutes, at least twice a day, with flossing every day. Using a mouth rinse a couple times a day. These are all great daily habits to get into to achieve optimal oral hygiene health.
And Jamie, I guess last question. I like Twizzlers. Don't eat them all the time, but is it okay to have the occasional candy? And people always talk about coffee stains and staining to the teeth. What about some of the foods that we're eating? I would imagine staying away from the high sugary types of foods would prevent decay, but what about things like coffee, tea, things that could stain your teeth?
So what we're eating and what we're drinking definitely impacts our overall oral health and the health of our teeth. Having an occasional sweet, like even, Twizzlers or really sticky, dense, sugary things, okay, every once in a while, eat it, be done. The key is not consuming these things in long periods of time. That Twizzler that you're going to eat every so often, eat it within a few minutes, be done, move on, try and rinse your mouth, brush that sticky stuff out. And that's, with anything that is very sugary, has high carbohydrate value to it. You want to consume these things in reasonable amounts of time. It really is the time and the frequency that's the most important thing to consuming anything, but especially things that are going to be much more wearing on our teeth and cause us to have a higher risk of cavities. So things like coffee that have staining factor to it, and teas and wines. It's hard to recommend drinking things like wines very quickly, but again,
you want to savor it, right? That's what they savor. You got to savor the wine, I guess.
Yeah, I usually will also recommend things like for coffee, especially if you can use a straw to help bypass the teeth and the time that you are drinking it, those things help. But again, when you have your cup of coffee, sure, drink your cup of coffee or two. Don't drink it all day, all morning. Give yourselves breaks. And the mouth really wants to be in a more kind of neutral pH acidity level. And when we're eating and drinking, it's fluctuating that pH. So it's important to obviously eat and drink. And yes, sometimes these things are going to be acidic, staining, not the greatest, but how we consume them is very important too. And also just in general, watching the amount of sugar, carbohydrates, refined sugars that we do have in our diet is obviously very important because that's what fuels the fire to help these cavities grow and become more problematic.
Yeah, I'm dreading no offense, but I'm dreading my visit to the dentist later this week. I thought of another question I just want to ask you real quick. The importance of oral health screening, and there's been an uptick in cancer. Another reason to come to the dentist, not only to get your teeth cleaned, to look at cavities, check out your gums, but also there's an oral screening for cancer that is done. They look at your gums, they look at your tongue, right? I mean, that is a very important aspect of this as well. You can get oral cancer.
Yes, it is very important. One of the many things that we are evaluating when our patients come in for any reason, cleaning or otherwise, we are evaluating and looking at all the tissues, including extra orally. We're looking around the face, but inside of the oral cavity, we are looking for things that are out of the normal that signify potential problems. We're looking at the insides of the cheeks. We're looking at the tongues, the throat, We're looking at all the tissues that surround our teeth, because a lot of times, unfortunately, it is somebody in the dental field that is going to notice something visually that could be off, and we could send them or do something like biopsy, refer them out to make sure that there's not any pathology going on to address things like that. So yes, oral cancer screenings are very important and something that should be done when you go to the dentist.
Absolutely. We got to have those good habits. Jamie, it's always a pleasure talking to you. Thanks for sharing a little bit of insight, and we look forward to having you back on the program again very soon.
Thanks for having me, Jeff. It's been great.
And that wraps up this episode of BRN AM. Have a topic of interest, someone you think we should talk to, drop us a line. And don't forget, for all the latest curated news in lifestyle, wellness, finance, tech, so much more all in one place, check out today's edition of our daily newsletter, The Morning Post. Want to search our archives, check out our latest content? We'll visit our website and, of course, all of our streaming partners. We're back again tomorrow for another edition of BRN AM. Until then, I'm Jeff Snyder. Stay safe, keep on saving, and don't forget, roll with the changes. Now is your opportunity to co-create content around any topic on the first lifestyle and wellness network. Reach a global audience through our platform and co-own exclusive branded content. All of our programs are available on demand and also as audio-only podcasts, so you can take us on the go. Broadcast Retirement Network, available anytime, anywhere, and on any device.
Tax audits, tax liens, wage garnishments.
Every day we hear stories like this about good folks who are simply struggling to pay their bills. Each of them are living a frightening IRS tax nightmare, and they are afraid it will destroy their lives.
I'm a divorced single mom, and my ex-husband left me and the kids with a lot of unpaid bills, including unpaid taxes. I was really starting to show my stress on my kids because the IRS had sent me a letter demanding a huge payment from me. I couldn't afford it. So then the IRS was threatening to garnish my wages. I'm already living paycheck to paycheck. That would have put me over the edge financially.
It truly seemed hopeless, but then a friend at work told her to call the tax relief line.
The people at the tax relief line, they told me about something called innocent spouse relief. They worked it out so that all of the taxes from my ex are not my problem. I don't know how that works, and I don't care. All I care about is that I don't owe the IRS a dime, and they are not going to take my paycheck.
Even if it seems hopeless, you should call the number on your screen right now. There is absolutely no cost for the call or the consultation. You are under no obligation. If you are worried that the IRS could garnish your wages, seize your assets, even take your home, call us right now. The Tax Relief Line is here to help you. Now you have a knowledgeable, professional team of tax experts that are ready to negotiate with the IRS and fight for you to save you money. The Tax Relief Line's professionals have successfully negotiated thousands of cases, reducing and sometimes even eliminating the tax debt for their clients. It's very easy to get started. Simply call the number on your screen right now. You don't have to live in fear anymore. The call and the consultation are free.